Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. I brought my dentist here today, Dr. Shila Yazdani. She is a dentist in the Bowie area. Welcome.
Thank you. Thank you for having me.
You know, this is such an important subject, and I've been trying for years to get another dentist on the show, and I am so glad that you were able to make it because there's so much good information that people know. Let's start off by talking about the fact that your dental health impacts every other part of your health.
Absolutely. As I always mention to patients, our mouth is a portal to our body. So the healthier we have our portal, the mouth, the healthier our overall health can be. And there has been tremendous amount of research showing how oral health is related to other issues that we experience in our body, such as cancer, diabetes, arthritis, stroke. So it's really important for patients to understand how to take care of their mouth and their oral health for their generalized health and overall health.
How is that connection made? How are your gums connected with your heart, connected with your whether you get diabetes, how is that? Is it about? It's about the bacteria.
It's about the bacteria and also the inflammation process that bacteria starts. So diabetes, heart disease, cancer, research has shown that the initial cause or the start of all these diseases comes from your inflammatory factors being higher than normal. And so what happens is that when you have inflammation in one part of the body, your entire immune system is trying to fix that inflammation or infection. And we constantly have cancer cells in our body, but our body is able to take care of it and get rid of it. But when you have inflammation in a certain part of the body, the immune system is focused in that area. And so it's not able to take care of the other stuff. And the research has also shown that some of these bacteria, they travel through your blood, and blood goes everywhere. It goes to your heart, to your brain, to your muscle tissue, to your organs. And so it starts that inflammatory process elsewhere in your body as well.
Now, is this hereditary? For example, if your parents have diabetes, you're more prone to become a diabetic. So is this hereditary?
Absolutely, and there are ways to check that. So we do offer saliva testing in our office where we check for interleukin-6, which is a gene marker that will show us if you're at high risk to getting any type of inflammatory disease, including gum disease or gingivitis. And a lot of times we know that that can be passed on from parents. The actual bacteria can also be passed on from a partner. So if you have a partner that has periodontal disease and you're kissing or sharing utensils or a glass of water, that can transfer the disease to the recipient, to you. So it's also good to make sure that your partner also has good oral health.
So how is that test done? Swab? Or?
So it's really simple. It's a little tiny vial of saline that we have patients just swish for 30 seconds. We also have them gargle in the back of the throat so we can get everything. And then they spit to the vial. We put a fixer in there to make sure that the bacteria doesn't overgrow by the time it gets to the lab. We send it out to the lab, and within 3 to 4 business days, we get a full report, which I brought a copy here. It's about a 6-page report. It's very detailed, and it's not written in a doctor language, it's written in a patient language, so that as you read it as a patient, you don't get lost in a lot of medical or dental jargon.
What kind of information does it tell you?
So the ones that it starts with showing you the different type of pathogen that's present in your mouth. So we have low-risk pathogens, we have moderate-risk pathogen, and high-risk pathogens. What that means is that low-risk pathogen will give you what we call gingivitis, which is just bleeding gums. That process is reversible. If you go see a dentist, you get a regular cleaning. You may have a couple of areas that are bleeding. We clean that area. It's not associated with a lot of inflammation. It's not associated with bone loss or hard tartar. That you can recover from. The moderate risk is bacteria that are now they're more aggressive. They're causing bone loss. They're causing moderate inflammation, and the patient will report every time I brush or floss, my gums bleed or they're tender. So then it shows us the population of those bacteria. The high risk are the ones that are very aggressive. And sometimes the high risk bacteria not only sit in the sulcus around the tooth, they now live inside the gum tissue, which is very hard to get. So if we know the bacteria that's present, we are able to attack that bacteria through a specific antibiotic. So not only we do the deep cleaning on the patient, we also place the patient on oral antibiotic, because as we said, these bacteria can get into your bloodstream and travel everywhere, and that way we can zap them at cellular level. It also will show you the gene, the interleukin-6. Are you low risk, medium, or high risk? And then it will kind of educate the patient as far as what that means. What are you at risk of getting? So if you are a high risk patient and you go through this report, it has a really nice chart. And for example, in this patient says you're at high risk of getting rheumatoid arthritis, a heart attack, cancer. If you're pregnant females, what pregnancy complications you may get, and then Alzheimer's as well. With diabetes, and it tells you specifically why. So this bacteria was present, overpopulated. This is why you are at risk of getting diabetes, because of this bacteria that was present. This is why you're at risk of getting rheumatoid arthritis. And again, puts it in a very simple, patient-friendly language, so that there's no misunderstanding or miscommunication. We share this data with the patient and their physicians.
Yes, that was my next question. Is this shareable? Can you share this?
Of course. So this comes in a PDF format. We always print it and give the patient a copy in the office as well. We email them a copy because they may go to several providers, so they can share that data with them. And then the feedback that we get from physicians, that they're really thankful, because this is not an information they haven't been told before, but now they can take better care of their patient.
When should you start talking to your kids about dental care?
Kids, based on AD, as soon as the first tooth comes in, you need to take your kids to a pediatric dentist or a general dentist, I think pediatric dentists are better to take a younger child to. And what we look for is, tooth growth, your skeletal growth. Is this patient on the right path growth-wise? It's a very short visit for a 6-month-old or a year-old that you take him. And then around 2 years old is when we want them to come in, so that they can get used to that feeling of someone checking their teeth, cleaning their teeth. Because at that point forward, then we can have a more compliant patient, and we won't have kids that are fearful of going to a dentist.
At a very young age, my daughter, I think she was like 2, and they had to end up taking the 2 front teeth out because they weren't growing properly. Her mouth looks gorgeous now. But back then, they had to pull. Though at that young age, they knew that things weren't going right, that something was wrong.
Right.
So you can tell pretty early.
Oh yes, we studied tooth anatomy, tooth health, growth, all of that when we're in dental school. So we're really, we're very well aware of what needs to happen. So
at what point should you start with your dental care period? What should your regimen be during the day? Is it to brush twice a day, in the morning, at night? Should you brush at lunchtime, after you eat lunch? How often should you brush?
So ideally, we want patients to brush and floss 3 times a day. However, we have patients that just get up, they drink coffee and then they go to work and they don't really eat anything until it becomes like lunch or dinner time, and then they eat something. So what I tell my patients is that if you can't do 3 times a day, at least do it twice a day. Make sure you do brush and floss at night, because then you remove all the plaque and food particles that got accumulated on your teeth, in the grooves and between the teeth. And flossing is really important, because if you
Yes, why?
Because it will cause in-between teeth cavity, which tend to be the bigger cavities. The ones that are on top of your teeth are usually smaller, but the ones that are in between your teeth, they become the larger ones. So again, I always tell patients, brush at night. If you don't want to have cavities, brush and floss at night. Brush and floss in the morning if you want to prevent gum disease. Why? Because plaque is a protein in our saliva. We can't get rid of our saliva. We're producing it constantly. So when you sleep, your saliva is sitting there, plaque will just attach itself to your teeth. When you wake up in the morning and you kind of scratch your teeth, you're going to feel the plaque because it was a protein, just sitting there. So if you don't remove that plaque will become harder within 12 hours. And to a point that a toothbrush can't remove it, floss can't remove it anymore. And then as it gets harder, it starts building on top of each other, and that's what we see as tartar. Or in dental term, we call it calculus because it looks like a stone. So it's a calcification of the same protein. So if you brush in the morning, you're constantly removing that plaque and you don't allow it to accumulate between your teeth or on your teeth. When you brush at night, you're constantly removing food particles so that you don't get cavities. So at least, very least, twice a day. Ideally, you want to make us happy 3 times a day.
What about the things like water picks?
I love water pick. I think it definitely has changed the way patients are able to clean between their teeth. I think that with a combination of electric toothbrush, it's phenomenal. Toothbrush, the newer versions of it were designed after our polishing instruments. So when you come and get your teeth cleaned and we polish your teeth, the Oral-B, for example, in the market was designed after our toothbrush. And I don't get paid from Oral-B, but the Oral-B does the oscillation movement and the shaking, so it really breaks up that plaque to tooth bond and removes it really efficiently. And then water pick I love because when we get further back in our mouth, that space between your teeth gets too big for a floss. And so when you use a water pick, you're actually able to just like flush the food and plaque from those areas. Sometimes, if I see a patient and they say, I am flossing, and we still find stuff back there, is because of that reason, because that floss was just too thin to go and clean those side of the teeth properly.
There's so many dental products
there are
out there that it's hard to know what to choose. Do you choose the Oral-B or do you choose the Sonicare? What's the difference? Is it the difference in the way the brushes move, or how do you know what's best for you? Is it just personal
talk to your dentist. Talk to your dentist. So if I have a very healthy patient, young patient, doesn't have tooth loss, doesn't have gum issues, but is a coffee drinker and has a lot of staining, I may recommend a Sonicare to them because they're designed to really remove stain. But if I have a patient that now I see inflammation, I see a little bit of bone loss, I see gum disease forming, I will definitely recommend an Oral-B just because it has a different type of action and it's able to go underneath your gums and clean those areas out. Sonicare just shakes, so it's not really going underneath, and if you try to, it doesn't feel good. With Oral-B has a smaller head, so it can go everywhere in your mouth, where even a manual toothbrush can't go in there because the head is too big. But talk to your dentist because these different companies come to our office and they train us and the staff as far as what their product has and who is it best for. And unfortunately, that's not relayed on TV or on the advertisement they put on. But talk to your dentist and they can definitely advise you.
How often, as much as I love you, I don't want to see you often, but how often should you see your dentist?
So if you do have periodontal disease, and periodontal disease is when you have inflammation or infection of your gums, if you have bone loss or recession of your gums, and your dentist will use those terms, or you've been told you need a deep cleaning, and you have gotten the deep cleaning. Once a patient has periodontal disease, they can never recover from that. Periodontal disease is an irreversible disease, just like having high cholesterol or having different autoimmune disease. Once you get it, it's a long-term disease. As healthcare providers, we know how to maintain them, but up to this point, we don't know how to cure them. So the medication for someone who has a periodontal disease is to definitely get the proper home care appliances, such as an electric toothbrush and the water pick or a hydrofloss. And then number 2 is come and see your dentist every 90 days. The reason is that the bacteria that causes gum disease lives in your saliva. And once it finds an opportunistic area, one bacteria can form a full colony in 90 days. That's why we need to see you every 90 days so we can remove these colonies before they start attacking your tissue again. So for periodontal disease patients, every 3 months. For someone who doesn't have inflammation, who doesn't have any bone loss or bleeding, we see them every 6 months.
You brought a chart with you.
Yes, I did.
And so tell us, what are some of the things that people need to know?
So this is just some facts, and it goes over all the research has been done, and it shows how the bacteria that's in our mouth can cause head and neck cancer, can cause cavities, Alzheimer. So any tooth loss or gum disease can increase your risk of Alzheimer.
Wow.
Yeah. Incidentally, when you have tooth loss, you're more prone to having sleep apnea and snoring as well. Gum disease can also increase your pancreatic and kidney cancer by 62%. 93% of people that have gum disease are at the risk of getting diabetes as well. It shows that it's been related, as I said, to rheumatoid arthritis. And Surgeon General reports that at least 80% of the American adults have gum disease, and that's a large number.
80%?
80%. So as I mentioned earlier, some doctors that are older or graduated maybe before 80s, because we learned about gum disease around 80 or so.
What did you think it was, or what did dentists think it was before?
So, I mean, we knew it was tartar, but at some point, one of the doctors figured out when I remove this tartar that gum stops bleeding, it heals. So we learned, if we start removing these and we allow the body heal, the body can heal. Before that, it would sit there, they would have bleeding, it would get infected, and they would have a loose tooth, and then it would lead to an extraction. So, I remember my grandmother, like at age of 50, she started losing all of her teeth, and she was in dentures. Now we have patients that are in their 90s, and they have most of their teeth left. So that's a huge difference from the 80s.
That's good news.
So we don't have to lose teeth because we now know the cause of tooth loss. And this, knowing about gum disease can help us prevent premature tooth loss.
Now, women, we go through a lot more hormonal changes than men. How is our tooth care, or how is our tooth health or dental health different, or how should we see it differently?
So again, studies have shown that for female patients, as we get through teenage years and we go to premenopause and menopause, we have these different changes in our hormones. And so, as a clinician, I see patients that are going through premenopause. Now they start, having cavities, having gum disease, inflammation is different. If they go through hormone therapy, definitely we see more inflammation. When they are pregnant, we see more inflammation because the progesterone is higher in their blood system. And then post-menopause, again, we see a lot of different changes in cavity or root caries. The salivary content becomes lower, so they complain about having dry mouth. And then also we see more gum disease. But again, if you see any sign of those, like, I'm feeling like I don't have enough saliva, or talk to your dentist, because again, there are ways that we can fight those. There are ways that we can tell you how we can arrest the process or slow it down.
As we just mentioned, there are so many products out now when it comes to dental care. We see a lot of the whitening products. How safe are they?
So anything over the counter is pretty safe because they put it at a very low concentration so that you won't be able to harm yourself.
Is that something, though, that should be taken care of by the dentist more so than yourself, or it's something that you can do yourself?
So I see a lot of younger patients, or patients that have an event to go to and say, hey, I want to get my teeth whitened. What do you recommend? First of all, we need to make sure they don't have any gum disease and cavities, because if you do have any of those and you use a white strip, it's going to irritate your gums. Or if you have a cavity in that too, it's going to hurt a little bit more, and your teeth are going to be sensitive. So definitely, if you're thinking about whitening your teeth, do an exam with a dentist. Make sure you're clear of cavities and gum disease before using it. If you don't, you're going to notice that there's more sensitivity or pain going through that. And then there are the ones that we prescribe from the office is patient specific. What is the shade of the tooth right now, if it's a red shade, brown shade, gray shade, or just a yellow shade. And so there are different materials that we can offer at different concentration to each patient.
How good is mouthwash for daily care? Do they really work?
They do. Well, I should say the ones that are over the counter are good for gingivitis only. So when a patient has gingivitis, they have bacteria that loves oxygen. So they're bacteria that are sitting above the gums. They love oxygen, and so you use it and it will get rid of those bacteria. Patients that have gum disease have bacteria that hate oxygen. That's why they're sitting inside the pockets of your gums. So what we see is that if a patient has periodontal disease, because they recognize, oh, my gums are tender, or the dentist told them you have periodontal disease, and now they're using over-the-counter medication, they're getting rid of the gingivitis medication, but they're actually allowing the bacteria that causes gum disease to grow at a more rapid rate. And the reason, again, in nature, we have good bacteria, bad bacteria, and they still keep fighting each other to keep each other at a certain population. But when you get rid of the good population that was getting rid of the bad ones, now this one can grow at a higher rate. Now, again, there are prescribed mouth rinses that are good for patients that have gum disease. And those are the ones that it can help break down the slime that these bacteria live in, the bacteria that hate oxygen. It breaks that slime, so it makes, when the slime pops, now they're exposed to oxygen and they die immediately. So we have those type of rinses, but right now, as of now, they're prescribed only, or they're only sold through dental offices, because they want to make sure that we're prescribing it to the right patient.
So you have to be careful when you just buy a basic mouthwash.
Right. So if you go and you buy a Colgate, it's good, but it's going to kill the bacteria that's oxygen loving, not the oxygen hating ones.
What role does nutrition play in dental care? Because I remember Mom saying, don't drink too much Kool-Aid with sugar in it, don't eat too much candy.
Right.
How much does nutrition matter?
A lot. So again, when I see a patient that has inflammatory disease or cavities, for example, we talk to them about what are you eating, what are your eating habits, and so high sugar, high fat content will cause these bacteria to grow faster, because you're just feeding them. So that definitely has it plays a factor, and also the frequency that you eat. So the more of a snacker you are during the day, we notice there's more cavities that form. And the reason is that you keep changing the pH in your saliva, and it keeps demineralizing your teeth. So again, we consult patients about eating habits, maybe snacking less during the day, or if you're snacking, make sure it's vegetables, a neutral thing. It's not too salty or too sugary, so we can keep an eye on the pH. Drink a lot of water during the day. I like water with a little bit of lemon to actually bring that pH back into a neutral zone when you have a higher pH. So those are some of the stuff that we talk to patients to make. And again, it's patient specific, because we have to sit at chairside and ask the patient, what are you doing? What are you eating?
Surprisingly, I've heard that sleep, how much sleep you get, can play a role in your dental health.
Of course. So just like anything else, when we get the proper amount of sleep, then we can, and you're in your REM sleep, you can produce growth hormones. We need growth hormones to fix our body. As we move during the day, even if you don't do anything, we keep breaking tissue, and so when we sleep and we get that good night's sleep, we create growth hormones that can fix all the damage in our body. So if you're not getting a good enough sleep, because now you're snoring, you have sleep apnea, or just you're a type that wants to sleep every just 4 hours, and you don't allow your body to go through the stages of sleep, and especially that REM sleep should be 25% of your sleep. If you don't get there, then we notice more issues when you come in. So those are stuff that, again, we see damages on your teeth, and we start talking to patients about how's your sleep, do you feel tired during the day, you know, and try to kind of do a quick screening before we offer a sleep test.
In the last few minutes of the show, are there any things you would like to make sure that the community knows about dental health?
I think the community should know that you definitely have to see your dentist at least twice a day. Not twice a day, twice a year.
I don't know.
Twice a day would be good, but no, twice a year. And then discuss issues like, you know, not only sensitivity, but, you know, other things that you may not think that your dentist should know about. A lot of times we give patients a medical history form, and they're like, oh, you're a dentist, you don't need to know I have diabetes, you don't need to know I had a heart attack, you don't need to know I had a stroke. But they don't understand that having that information is critical for us to start looking for, because then we can play a good detective. We start looking for other stuff, and then we can better help you as a patient.
You know, I never thought about that, but yeah, I probably would be one of the way, oh, he doesn't need to know.
Yeah. Or like, you know, are you on birth controls? And patients don't understand why we need to know if you're on birth control, because now there's a change in your hormones. So if I see bleeding in your gums, I'm going to talk to you, you know, what type of birth control are you on, or what type of hormone therapy are you on? And then I can work better with your, you know, OBGYN to see how we can change that so that we don't have this inflammation in your mouth, so we can help you have a healthier you know, oral health.
Last but not least, if you're not a regular dentist goer, what are the signs that you should look for that, hey, I might need to make an appointment? Not just, oh, I think I got a cavity, my tooth hurts.
I mean, I think the first sign that usually comes up is bleeding. So if you're brushing your teeth and you're spitting and now it's pink, you know, that's kind of like the first sign, because that's usually the first thing that we see, and then it leads to cavities, and then it leads to tooth sensitivity, or it was sensitive but it went away. It usually doesn't. Dental disease doesn't get better; it just keeps getting worse, you know, and it doesn't go away with just an ointment or an antibiotic. So that's what you know, the community has to know, that dental disease doesn't heal itself. It needs a dentist, it needs a provider to help you.
And if you do have gum disease, you need to start seeing the dentist on a regular basis. One other important thing you mentioned, that if your spouse, if someone you're with has, they can pass it on to you. I did not know that.
Well, one other thing I want to mention is about oral cancer. So again, the same test, we can find out about oral pathogens, which is HPV, that can cause oral cancer. And so we always tell female patients, if you had an abnormal HPV, please bring your partner in so we can see if they have HPV as well, because there's a lot of them that have been linked to the oral cancer as well. So.
Thank you so
You're
much
welcome.
for joining us this morning. The time passed too quickly.
It did.
We've been talking to Dr. Shila Yazdani, and she's a dentist, and we will put your information at the end of the program if people are interested in contacting you.
Thank you.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Enjoy the rest of your day.